everyone, welcome to my channel. My name is Marina. I'm the mite medic. I wrote the book, The Demodex Solution. It's a 90-day program that helps heal your mites naturally from within. I am here to talk about how Demodex is correlated with folliculitis. Demodex is a mite that inhabits all of our skin. So it inhabits all of us. Its population increases when our immune system is lowered, or when we are under stress, or certain environmental factors might increase its population. Even medical conditions can increase its population. Folliculitis is the inflammation of the hair follicle. And in this video, I wanted to explain the correlation between the two and how they are connected, because they most definitely are. In most cases, folliculitis is caused by the Demodex mite because the Demodex tends to inflame the hair follicle. So Demodex mite lives in or near the hair follicle usually. This is because they're very attracted to the oily glands of our skin and the oily parts of our skin. So they are more attracted to the sebum. These mites can physically block the follicles or cause damage by burrowing into the lining of our hair follicle, leading to inflammation and folliculitis. Another reason is your immune response. Your immune response can trigger Demodex. It can be any factor, any lifestyle factor, any trigger. It could be a food, it could be mold, a flare-up of any sort that triggers this folliculitis or this Demodex mite overgrowth. Folliculitis is basically the symptom of a Demodex mite overgrowth, to put it simply. And lowered immune responses can most definitely trigger a Demodex overgrowth, Demodex proliferation, and folliculitis, which is inflammation of the hair follicle. So sebum production, why is it very important to us, and why should we lower our sebum production? Because Demodex thrive in sebum. That's their main food source. The Demodex love the hair follicle. They love to eat the sebum in the sebaceous glands in the hair follicle. And this excess sebum can block the hair follicles, resulting in inflammation. So another reason can be a bacterial co-infection. So Demodex can encourage the growth of Staphylococcus bacteria. Mites may introduce or exacerbate bacterial infections as they break down those follicle walls. So that's why it's very important to have great skin hygiene and to also have a balanced diet. Sebum production, excess oil in your glands, they can be caused from higher blood sugar. Blood sugar is obviously balanced through diet. We're looking at having a balanced diet, eating the right foods, lowering processed foods. It's all a cycle, it's all connected. So the better our diet, the better our lifestyle is, ideally the sebum should be lowered and the Demodex mite should be starved. When we introduce topical solutions, they're very drying to our skin. So there's only a certain amount of time, a certain amount of effort we can put in to utilizing topical solutions, because they do tend to be extremely drying for our skin. In the long run, you still have frequent flare-ups that occur because the root cause hasn't been addressed. It's something that can be very simple. Removing a certain food, removing some sort of environmental factor. It could be mold exposure. It could be just lack of hygiene. It could be pets. An autoimmune disease that you need to heal first. So there are many ways. And also Demodex is triggered, folliculitis is triggered by exacerbating factors. One interesting aspect is that rosacea can actually trigger folliculitis. Rosacea can be a contributor of folliculitis. That's because rosacea has different causes as well. So why can rosacea be or exacerbate folliculitis? Rosacea is usually caused by a high density of Demodex mites. And so if Demodex mites cause folliculitis, they are also, in any patient who has rosacea will be very prone to folliculitis or follicular infections. Rosacea also causes a very weakened skin barrier. So a lot of irritants, a lot of pathogens can penetrate through, and this can weaken the skin barrier, causing Demodex mites to penetrate through. causing a higher density of them and for folliculitis to occur. Also, the inflammatory response. Obviously, rosacea is an inflammatory condition where it's responding to some sort of irritant. It's responding to some sort of immune issue. All of that lowered immune system can cause those Demodex mites, and then of course the folliculitis. So increased Demodex density can cause folliculitis. Also rosacea can be caused by that. We don't know if Demodex causes rosacea or rosacea causes increased Demodex density. We just know the patients with rosacea have a high Demodex density. So a few solutions or topical treatments you can use for your folliculitis can be shampoos with a high oil density, healing oils in them, healing herbs that can heal specifically inflammation of the hair follicle. These substances can be tea tree oil, neem oil, it can be sulfur. They do tend to be drying, so that's why you do have to implement a good dietary and lifestyle protocol and supplementation to fully heal. Comment below, subscribe so we can get the videos out there more, so that we're teaching others and getting the word out, because I know that there isn't much information on this subject and we want to get it out there. Everyone struggles from Demodex mites. Some certain points of their life they just don't know, or everyone has them. Let's work on this together and shine a light on others so we can help them find the root cause of our troubles. A healing approach that is holistic. I appreciate it. Comment down below, and thank you so much for watching.